All right, let's talk about what's been going on with the Ascension cyber attacks. It's been a week already, and there is no end in sight. I've spoken to a lot of you, and I've gathered a lot of horror stories. I gave an interview to a reporter earlier. I'll post that later. Keep sending me your information if it's anything different from what I'm going to share with you. But let's talk about it. So, for those that don't know, Ascension is the largest Catholic hospital chain in the United States. There are numerous states. There was a week ago, I believe it was on the 8th of May, a massive cyber attack, ransomware situation. Basically, all of the systems are down and there's no end in sight. It differs a little bit, of course, place to place. Each one is sort of dealing with it a little bit differently. But we're being told by Ascension that it could be weeks, days to weeks to months. There is no end in sight at this point. Rumors are that it's, ransomware from, I'm told, the Russians. I don't know. But this is not the first time, right, that Ascension has been a victim of a cyber attack like this. I believe it affected their Kronos before. And speaking of Kronos, I hear that a lot of the Ascension employees are due to be paid this coming Friday, the first payday since this happened. So fingers crossed, hopefully that has not been affected. But let's talk about some of the horror stories. It's essentially a crisis situation. No matter how you look at it, they are dealing with a crisis situation with little to no support, allegedly, and no end in sight. So everything is being delayed. Everything, testing, everything is being delayed. Has private patient information been compromised? We don't know. Probably. We don't know. Everything is on downtime, meaning none of the electronic medical records, electronic health records, none of those are up and going, like Epic, any of them. They can't utilize those. So they cannot, nurses, all medical professionals, doctors, they cannot access the patient's medical record online. They can't read an H&P. They can't look at, none of that is basically available. They cannot put in orders online. So providers are having to handwrite orders, which for old nurses like me, it's like not a big deal. We're so used to that. And some of this stuff I'm like, okay, so you have to document on a paper flow sheet, like cool, easy, so easy, actually quicker. And you have to go back to like the 3-ring binder, archaic, handwrite orders, chart. Like a lot of us did that for so long that it's kind of ingrained in us and it's a no-brainer. But a lot of nurses that are currently bedside now are no longer experienced nurses that had to deal with that way back in the Stone Age, So I could see where that could be very intimidating. And that's just only like a little tiny part of it. So they're not getting an alert if there is a new order from a doctor like you would. So they're putting like Post-it notes on charts and things like that are wholly unreliable. Tube systems are down in some places. So nurses are having to leave their patients, leave the unit to deliver things everywhere. Labs, all sorts of things. They have to call for everything. So if there's a radiology order, lab order, they have to call and then put it like a printout and all the things. They've definitely had patients that have suffered adverse outcomes already as a result of this. I've heard of numerous alleged incidents. In some places, the alarms are not working. So like if a patient's on a central monitor or tele, whatever, they're not getting notified. There's no alarm working. Again, this differs place to place. The ones that really concern me are the Pyxis. Their automatic medication dispensing cabinets, wherever they are not working. So everything is being overridden. Every medication has to be overridden. That's a problem, right? And then they can't scan it. So they can't scan the patient's ID band or the barcode. I mean, it immediately makes me think of Redonda Vaught, right? Like, that's the situation she was in at that time when that happened. And then, you get the clueless, absolutely clueless managers that are like on vacation, still taking vacation in some places, like the audacity, right? When you're in a crisis situation to leave, or that are going around pushing the totally unimportant things in a time like this, like your suicide risk score, your fall risk score, all handing everyone, nurses that don't know which way is up, and they're coming to them, handing them paper after paper saying, you need to do this, yeah, those things are important, but right now on the priority scale, not important, right? You've got some hospitals that are going on divert, others that are refusing. Why do they refuse? Because they don't want to lose the revenue. So I'm going to say this. If you are the public in any of these areas where there's an Ascension hospital, if you're a patient, if you have any other option other than an Ascension facility in your area, go the other way because this is not where you want to be hospitalized right now, allegedly. Okay, this is not sustainable. Nurses, the tensions are high. I can't imagine what they're all dealing with. The fear of patient safety out the window, all the safety checks out the window, fear of your license out the window. It's terrible. And, this happened during Nurses Week. That's not lost on me or anyone, right? So not only are nurses, once again, not being appreciated or recognized during Nurses Week of all weeks, but we are putting them in absolutely dangerous situations right now with little to no help. Here's the worst part, in my opinion. Ascension has immediately started putting out public statements that, like, everything's fine. There's nothing to see here. Everything's fine. All the employees have been trained in this. They're ready for this. It's fine. We have processes in place. And I'm being told by countless people from multiple locations that's absolutely not true. They handed us a packet of papers, like downtime forms. That's it. There was no training. There was no preparation. We have absolutely not been prepared for this. It just sounds like an absolute nightmare. So if it were me, this is just what I would do. My opinion, you do with it what you want. I would be documenting something on every patient, every shift in the medical record, even if just one line. Care, I don't know off the top of my head. All patient care for this shift occurred during a downtime under cyberattack or something. I don't know. I'd have to come up with better verbiage for that. But just so that if, God forbid, anything ever goes to court, it is there that all the safety checks, all the systems were down, not available to you to, kind of cover you. But also, are they staffing better to accommodate for this? Since everything is taking twice as long, you should have extra staff on, right, to be double checking things since all the safety checks are out, right? Are they doing that? In a lot of places, I'm told, no, they're not. Ascension should be stepping up. They should be offering major bonuses to get people to come in and work extra and overstaff in a time like this. Also, in some places, forgot to mention, the call light systems are not working. They're passing out bells, like little actual literal bells. There's no patient tracking capabilities. So like a bed board, a central, they're having to basically invent new processes, each individual unit, hospital on their own, like making spreadsheets and different things. Like every single aspect appears to be affected. Phone systems, internal phone systems, paging systems down in some places still, and in other places it was, and then it was resolved. And so employees are having to use personal cell phones to page providers, which, HIPAA, right? Just an absolute disaster.